I'd like to introduce you to something that perhaps is common sense, is not necessarily new, but looking at it in a little different way, and that is the concept of daily debridement and decontamination. Now, we as dentists have talked about plaque control for years and the impact it can have on periodontal disease and so forth. And yes, this is part of this concept, but we're going to expand upon it. So if you would bear with me, I'd like to kind of show you some ideas that I'm thinking about. Now, we've already talked about the debridement of the teeth, and certainly that's our brushing technique. But now let's talk about the debridement and decontamination of the tongue. In 1972, McNamara and his colleagues reported that the major cause of bad breath are the bacteria found on the posterior part of the tongue. These are volatile sulfur compounds, VSC, and these are gram-negative bacteria and anaerobic gram-positive bacteria, and this research was done by Lopez and his associates in 2014. In 1998, Gordon Christensen published an article in the Journal of the American Dental Association on the importance of removing these organisms on the posterior third of the tongue. And here is that reference. Now, 90% of malodor is caused intraorally, and only 10% is caused extraorally. And this was also reported in the Lopez article that we quoted a moment ago. So these are the conditions that contribute to malodor. And we've got a list of several here, and I'm not going to take the time to read all of these to you. I'm just going to hesitate a moment and allow you to read them. And certainly, if I did not allow you enough time to do it, you can stop the video and look at those. After brushing and flossing, 90% of the bacteria in the mouth are found on the posterior third of the tongue. And the only way to remove these bacteria is to vigorously scrape the posterior part of the tongue. And Lopez also found that scraping the tongue was ineffective unless it was part of a daily oral hygiene or disinfecting regimen. The instrument that I like best for scraping the tongue is called the tongue sweeper, which was developed by Dr. Robert Ripich, whose picture you see here. You can order this online, and the model that I like is the Pro model, and this is the original model that is on the right. And you can see underneath, if you order this online, a single one is $17, or you can order a pack of 12 for $77 if you want to send these to other family members or friends. If you have family members that you live with, then you can order these color-coded, as you see here, for the same price. Here you see the contact information on Dr. Ripich, and he would prefer, obviously, that you order these online. And before we go any further, I would like to say that I have absolutely no financial interest in the tongue sweeper. I do not own stock in the company or anything like that. Now let's talk a little bit about typical mouthwashes. The classic one is chlorhexidine, which kills bacteria by disrupting the cell membrane, and that needs to stay in contact for a significant period of time to be effective. But one of the drawbacks to chlorhexidine, it puts a black-brown stain on teeth. Next are the essential oils, which are found in Listerine and other mouthwashes. Third is hydrogen peroxide, but this is only effective about anaerobic bacteria. But the least expensive, most effective mouthwash is a solution of sodium hypochlorite, which is found in household bleach such as Clorox. It not only kills bacteria and viruses and fungi such as yeast infection, but it kills on contact. But before you make a conclusion about using this, you need to look at the video on the most effective, least expensive bactericidal mouthwash, which is sodium hypochlorite. And this is used in a very diluted solution, 1 teaspoon to a quart of water. So go to this website and look this up before you draw conclusions. But there are other benefits to cleaning the tongue or disinfecting the tongue, as we've talked about. And here's an article, The Association Between Oral Health Status, Respiratory Pathogen Colonization with Pneumonia Risk in an Institutionalized Population. And this is a recent study that was just published in 2018. This was a study done in a long-term care facility, and the patient population was composed of 60 individuals. At the initial exam, scrapings were taken from the tongue, and 48.3% of the 60 patients demonstrated these bacteria which are associated with a lung infection and pneumonia. So we had a high percentage of the patients that had significant bacteria. Now, during the study period, which lasted 1 year, 17 of the 60 patients, or 28%, developed pneumonia. And here's what they did at the onset of the development of pneumonia. Again, they took scrapings from the tongue, and they also examined the sputum. And the patient population of bacteria on the tongue perfectly matched those in the sputum. So this was significant, in my opinion, that by scraping and cleaning the tongue, we may reduce the risk of an elderly population at least developing pneumonia, which adds a totally new component and reason for not only scraping, but disinfecting the tongue. Let's do some speculation. The first speculation is disinfecting the tongue may have a positive impact on reducing the risk of developing pneumonia. Speculation number 2, disinfecting the tongue may prevent oral cancer by killing the human papilloma virus, or HPV. This video that we're going to be showing now is going to specifically show you how to use this tongue scraper that we've been talking about from Dr. Robert Ripich. And this is the classic model. Now, in the video that you just saw, we talk about the toothbrush, and look at the size of this toothbrush. And people say, I brush my tongue. This is what they do. They're brushing the anterior part of the tongue. But as big as that toothbrush is, can you imagine getting it all the way back there? Damn near impossible. So that's why I advocate using the tongue sweeper. This is very important. The gagging sensation comes from touching the roof of the mouth and the side of the mouth. It really does not come from the tongue. So think about what you're trying to do, and notice when I place the tongue scraper in, I don't go straight back, I go back and down, staying on the posterior part of the tongue, somewhat depressing the tongue. And what I want you to notice, and I'm going to use this dish here, typically you do this in the bathroom, but I'm doing this in front of the camera where we've got better light on this. So notice when I put this back, look how much I scrape that. And when you do it in the bathroom and you look at the sink, you'll be absolutely amazed at the mess that comes off the posterior part of the tongue. Now, how often do I do this? First of all, you need to do it thoroughly. So let's sort of count and see how many times I do it. Now, I did that probably 10 or 12 times. So let's remember the sequence. Remember the video on a more effective way of brushing. Then you want to do interdental cleansing. And on that particular video, I talk about why patients don't floss and so forth. And then the next thing that you do, remember, we just did a video we showed you on how to mix up exactly 1 quart of sodium hypochlorite and using a teaspoon to do that. So the first thing that you want to do is brush. The second is floss. The third is to rinse with this solution. You want to gargle and suck it between your teeth because we're trying to kill those sulfur-forming bacteria on the posterior part of the tongue. And then once you're through doing that, remember on the video, the Center for Disease Control says that you can make contaminated water potable or drinking, and if it is clear water, you can put 1/8 of a teaspoon of sodium hypochlorite to a gallon and you can drink that. Or if the water is cloudy, you can put in 1/4 of a teaspoon of Clorox and do that. But then I advocate, after you have used the sodium hypochlorite rinse and you have scraped your tongue, that you can take a little water like this, spit that out, but then this is an 8-ounce glass of water. Now, if you have inadvertently swallowed a little of that solution, think how diluted it is going to be and probably down to the level of the solution that would be talked about by the Center for Disease Control. So I think we need to think in terms of a whole new concept, not only of plaque control, but total decontamination of the mouth. And this includes thorough brushing. It includes a certain interdental cleansing, and it deals with the sodium hypochlorite, and it deals with the tongue scraping. These are the 4 components if you want to have a sweet smelling breath and really control the plaque in your mouth. Enjoy.